Oh, hey there, this is Dr. Evan Osar with Discover IMI. Welcome to this edition of Integrative Movement Insider. Hope you're having a great weekend. Today, we're discussing the rotator cuff because did you know that 1 in 3 older adults, older being relative, I'm older, in my 50s now, so 1 in 3 older adults have a rotator cuff tear, either a partial tear and or a full thickness tear, meaning the muscle's completely severed. Now, this does not mean that every single individual that has a rotator cuff tear has pain. In fact, many individuals have rotator cuff tears, either partial and or complete tears, and don't have any pain from it. For example, I had a client that he calls me up. He's like, hey, I fell in the shower, my shoulder's in a lot of pain. I'm like, well, you need to go see your doctor because he's like, I can't even lift it over my head. So I'm like, you probably did some significant damage. Went to the doctor, had an MRI, had torn 2 rotator cuffs, completely severed them. When he saw me about a week later, so just a week after he completely tore 2 rotator cuff tears, no pain. So when we talk about clients or individuals that have rotator cuff tears, because this is what a lot of people will say, hey, everybody has rotator cuff tears, it's normal. Well, here's what happened. He tore 2 of the tendons and he's like, I can't get my arm up to my face to shave my face and or to drink water. He's kind of like this because one of the muscles he tore was the subscapularis. The subscapularis is a muscle that sits in the subscapular fossa where I'm pointing right here. Sub meaning underneath, scapula meaning scapula, so it's sitting underneath. The other muscle he tore was the supraspinatus. Supra meaning above, spine is this spine of the scapula right there, so the bone that you can feel if you touch somebody's scapula on the back side. And this supraspinatus runs right through this groove right here to then come underneath this space here to insert into the head of the humerus. So he tore both those muscles. Why did he have such trouble? He couldn't shave his face or drink water without doing all kinds of contorted things because the subscapularis is your primary muscle that will help you internally rotate that humerus. Well, this, drinking water or shaving your face or scratching your face like this requires internal rotation. So no pain. He had no pain. He actually had full range of shoulder flexion. He did not have full range and much range at all in internal rotation. And obviously there's a lot of muscle weakness. So when people say to you, hey, the studies don't show that having a tear is normal, what I want you to think about is the function of the muscles that are torn, and then do your assessments to determine if your client has truly lost function, because almost all the time they have lost some function, because if you have a partial tear, you're going to have weakness of the muscle that was torn. If you have a complete tear, you don't even have function of that muscle, and yes, there's other muscles that can compensate. So for example, for your supraspinatus, you have deltoid muscle that can compensate. The problem is the supraspinatus has a very specific role. It will, just imagine this is the humerus, the right humerus. Here's your supraspinatus tendon coming over top. I'll use my band here. So just imagine that this red band is the supraspinatus tendon coming on top of the humeral head. So what it does is it drops the humeral head down so then the deltoids can then bring the arm further up. Well, this muscle's torn, even partially torn. Well, now the first motion that happens is rather than this motion happening, the abduction, and that's why the supraspinatus is said to start or begin the first 20 degrees or 30 degrees of abduction, it drops the humeral head down, and that allows the deltoids to pick up the slack and then bring it up the rest of the way. If you don't have that muscle because it's either functionally weak and or torn, completely torn, well then you're going to keep jamming that humeral head up into the backside, or the bottom side I should say, of your acromion process, and that will create suboptimal movement of your shoulder. So unless you have a MRI, you don't know for sure if your client's rotator cuff is torn. However, you can do some assessments. Shoulder flexion, look at shoulder flexion. But as I mentioned, my client with 2 completely ruptured tendons or torn tendons had complete shoulder flexion, no loss of range of motion. So now you have to be more careful about looking at external rotation. So you need about 90, and he had about 90 degrees of external, but he had very limited internal rotation. So this is 0. You need at least 30 degrees of internal at least 30. You actually need more like 45 to 70 degrees, but you need at least 30. That's about 30. So that's the minimal amount you need to do functions of everyday life and not sort of compensate with your shoulder coming up like that. So whether you know your client has a rotator cuff tear and or you don't know, there's three, I'm going to share with you three of the best rotator cuff exercises. So even if your client has a complete rupture like my client did, his option by the surgeon, I sent him to the best surgeon in Chicago at the time, worked with a bunch of the sports teams. He's like, your only option at this point is to have a shoulder replacement. He wasn't ready for that. So you have to do the best you can with what you're working with. Yes, you'll never give him back this sort of range of motion because he doesn't have a subscapularis. But we do our best to help that individual with the muscles that are still working. So I'm going to share with you the three best rotator cuff exercises that we use with our clients, that we found that work with our clients, knowing that they will not work for every single individual. Now, one of the first things we want to do is release. So our first exercise is a release exercise. So it's technically not an exercise, it's a release. But if you don't do this release, well then the tightness of muscles that will compensate, very commonly, teres major. Teres major comes off the outside of the scapula here. So this is a left scapula. So the teres major is coming off this lateral edge or the outside edge of the scapula, and it's going to the humeral head. That along with the lats, which comes up around the underneath side or the back side of the scapula to insert into the humerus, those two muscles will both limit shoulder rotation as well as compress the shoulder and also can depress the shoulder. So the first thing you have to do is find out where your client is restricted. These two muscles are very common, and then teach them a release. So we love the roll gut. Normally I would put them on the floor, but for sake of this video, I'll show you how to do it on the wall in case your clients can't get down on the floor. But again, what I'm doing right here, I would just do it on the floor with my client if they could get there. The foam roller, the roll that goes right in here between the humerus and the scapula, the ball and socket joint. You just lean up against the wall so if my client cannot get down on the floor, they just lean up against the wall. They're going to breathe in. They can lean into that tender spot or tight spot, breathe out, and then just reach their arm. Okay? They can reach their arm this way. So they can breathe in, breathe out, reach out forward, and breathe in, breathe out, and or reach across their body. So that way I'm compressing that tight spot. I'm also doing a little bit of pin and stretch as I do that. And we'll do about 10 repetitions. Okay? The second exercise, this is one of our favorite go-to exercises, is the band pull apart. We like the loop band. Here's why we like the loop band the best. And again, use the lightest band you have because most of your clients will strain so much to get the right position that even the lightest band will challenge some of the strongest individuals. So you put your hands in the loop band. Oh, the other reason we like the loop band is because your clients that may have grip issues, and they'll grip and they'll just sort of tighten their wrist and their fingers and their wrist, and they'll contort their wrist. So we like the ability to open the wrist up because we don't do a lot in everyday life that teaches us how to use our extensor muscle groups. So put your hands in the band, pull it apart like this. And again, this is why you want a light band. You want to pull it about shoulder width apart. So again, now you see that I have extension, neutral wrist position, extension, relative neutral or a little bit of extended finger position, abducted finger position. So the fingers are not like this, the wrist is not like this. It's neutral wrist, fingers relatively extended, arms pulled apart, and now I can create that nice wide optimal shoulder position, scapular position that will help to facilitate optimal rotator cuff function. It also, this motion here, by pulling the arms apart, you'll feel this activate the backside of your shoulder. So as I do this motion here, I feel the activation along here as well as underneath here, my serratus, but also my rotator cuff. So the rotator cuff muscles that are still functioning well, if your client does have a tear, this is a great exercise to do. We'll just have them hold an isometric position because this alone is challenging. Once they get the idea, then we can have them breathe in, breathe out, and slowly elevate because we want to teach our clients how to activate their rotator cuff and still create optimal motion. So here we go, number 2 exercise. Okay, first one would be more of a release than an exercise. Again, the release helps to allow you to have the ability to move the shoulder in a proper position. The band pull apart starts to activate the shoulder stabilizers as well as the rotator cuff. Third and final exercise is some kind of hip hinge. Some version of a hip hinge sort of plank position. One of the things that we teach our clients, we teach as part of our certification program, and I share in 2 Anatomy Geeks, series on the rotator cuff is the hand feeds back into the shoulder. So the hand and wrist position is important for the rotator cuff. Obviously, when you grip, I should say obviously, when you grip something really tightly, you activate the rotator cuff muscles. So carrying positions are very important. I'll talk a little bit more about that in a moment. But something where you can have your client's hands on the wall, for example, in this position, if they're strong enough to be on the floor, but we're just retraining the rotator cuff, have the hands on the wall like this, about shoulder height, pull that wall apart, and now you can just hold that position. You can do a hip hinge from this position, or a modified wall version of a downward dog, or you can do that on the floor as well. So that way, you're teaching the individual how to align the hand and wrist, the elbow, and then the shoulder, which will facilitate more optimal rotator cuff function. And then finally, as I mentioned, when you activate, or I should say squeeze the hand, it activates the rotator cuff. You can do this with a partner. If you had a buddy with you, you could just squeeze your hand, or take someone, just do a handshake and squeeze their hand, and you will feel, put your hand on their shoulder, you will feel their shoulder muscles start to activate. So that's activating the rotator cuff. So something where they're gripping. I don't have a dumbbell or kettlebell here, but just so they can grip the rollga, just grip the rollga. If it's too big, then obviously grab something a little bit smaller, even a can. Grab a can, and you can activate the muscles of the hand and wrist, which activates the rotator cuff, and you can have your clients just walk around, gripping that. Just have them walk, just sort of walk normally. They can carry it like this. This is a great position to facilitate the optimal position of the shoulder, as well as develop the rotator cuff by that gripping function. So there you have it. A release. I showed you the band pull apart to develop the wrist extensors, the neutral wrist position, to develop the shoulder position and the rotator cuff, activate the rotator cuff and scapular stabilizers, the wall hinge, or you can do that on the floor as well, and then some version of a carry pattern. So either carrying down here, again, just gripping, if your client just has soup cans, just grab soup cans and just walk around like that, gripping around the soup can, or carry in this position, or just hold a kettlebell, a very light kettlebell or dumbbell up in this position will help to activate the rotator cuff. Excellent exercise for the rotator cuff. So I hope that made sense. Hope you learned a little bit about the rotator cuff and why some clients may have a rotator cuff tear and have no pain, yet still not have optimal function. And some strategies, I shared some strategies to help them, or help them create a more optimal posture and movement strategy to the best of your ability if they do have a tear. And even if they don't have a tear, these exercises are great for helping them maintain optimal function of the shoulder. I know that's a lot. Hopefully it made sense and gave you some good ideas. If you're looking for more information and you need CCs, check out two Anatomy Geeks, the rotator cuff, Anatomy of the Rotator Cuff. Jill, my fellow anatomy geek, and I put together this 3-part series on the rotator cuff to teach you more in-depth function of the rotator cuff, as well as a shoulder complex in whole. So that way you are educated and can in turn educate your clients that even if they have a tear, there's still things that they can do. And then you understand what the rotator cuff function is and why some exercises are great and why some exercises don't work as well to improve rotator cuff function. But we just don't want you to understand the information. We give you strategies to assess and use the most optimal functional exercise, corrective and functional exercises to improve shoulder function. So that way you directly apply the information you learn. It's not a situation where we say, hey, here's great information, go figure out how to use it. No. We show you how to use this information and apply it to real life clients. Not the athletes, not the clients that can do anything they need to and want to do. It's the most challenging clients. We use this information on our most challenging clients in our office, our older clients, our clients that are coming in with rotator cuff impingement, rotator cuff tears, and it's the same strategy I use with my own shoulders, with rotator cuff tears in bilateral or both shoulders, as well as labral tears in both shoulders as well. So we know this strategy works, and then we show you how to take this into some functional exercise progressions so you can incorporate that more optimal posture and movement strategies into patterns that will help strengthen the shoulder and develop more optimal function so your clients can do the things they need to, want to, and love to do. And this week, when you use the code CUFF, C-U-F-F, CUFF, you get 50% off this program. Normally it's $99. You get this program for this next week for $49 using the code word CUFF, C-U-F-F, all caps. Put that in the box when you check out, and we'll see you inside the program. If you have any questions, feel free to reach out, let me know, and we look forward to seeing you in 2 Anatomy Geeks, Anatomy of the Rotator Cuff. Go out there, be the leader your current clients need and your potential clients are looking for. Take care. This is Dr. Evan Osar with Integrative Movement Institute. Happy Sunday.